I was wondering if people with seizures, can they drive?
So driving is a really big issue for most people who have seizures, especially as they come of driving age. And the simple answer is yes. For the vast majority of people with epilepsy, you can drive. There are some considerations as to how well the epilepsy is controlled and what the circumstances are that are likely to cause seizures or favor them. So you have to look at, one, the state guidelines of the state you're in terms of what the medical board or the Department of Motor Vehicles has determined is a guideline for driving. Most states have anywhere from 3 to 12-month waiting periods after you've had a seizure before you can be allowed to drive. There's a lot of details to that, which sounds pretty harsh if you think a 12-month period, but most of the states have also medical boards that will consider circumstances, and you can certainly ask your doctor to write a letter if there are circumstances whereby you shouldn't have to wait. If, for instance, you've been directed to get off your medication because you've been seizure-free for a period of time and you have a seizure, you don't have to wait once you get back on your medications. So if you're having a seizure when you're under the direction of a medicine change or a taper of your medicine, again, you don't have to wait any long period of time before getting back on the road. We try to advise people to use common sense, and in general, I like to advise young drivers to impose upon themselves a Cinderella license so that they're not out driving late at night tired, because I think sleep deprivation and being tired is probably one of the most potent triggers for seizures, and to be driving is not a good idea if you have epilepsy and it's late at night. If you do get tired and you are driving and it's 2 in the morning, pull over, take a rest, take a nap. It'll probably save your and perhaps someone else's life. The other part that is an important consideration is texting and cell phones and drinking and driving. In large studies across the country, those have been shown to be 150 times more likely to be the cause of an accident than having epilepsy, which ranks at about the same percentage as having diabetes or having cardiovascular disease or any other number of conditions that are common medically. And in fact, people with epilepsy rarely have seizures while driving. So I think if you keep your wits about you, keep well rested, avoid triggers that might cause seizures, avoid cell phone usage, avoid drinking and driving, that you're less likely than other people to have an accident while driving, a seizure while driving. And so yes, you can go for your license, you can participate in driver's ed within certain guidelines that I think if you check with your doctor, they can easily give you. Generally, reproductive health is unfazed by having epilepsy. There are some complexities to it in terms of planning for a pregnancy if you're on medications and wanting to make sure that you're on medications that are safe for the baby. And the dosing may have to be adjusted to make sure you don't have seizures. But carrying a pregnancy fully through is very possible and achievable goal despite having epilepsy. I think that the reproductive health of people with epilepsy is the same as the reproductive health of other people. And with a few considerations of knowing that the medicines may play a role and knowing that the epilepsy itself may be a little bit more vulnerable after you've delivered a baby because your body's going through many changes and the medications may need to be adjusted. You're probably sleep deprived with a new baby. And so for those considerations, you do need to be a little more cautious and a little more aware. But yeah, you can absolutely have a baby. Well, I think it's really important to know that there are a lot of medication interactions, and one of them is with birth control pills and anti-seizure medications. Not all of them, but most of them, and it's probably best to assume all of them, because it makes it easier to not think that, oh, I'm on a safe one. And the interaction that occurs between estrogen-containing birth control pills and seizure medications is that the birth control pills and the seizure medications are both going through the liver to be metabolized, to be gotten rid of and processed. And so when the liver sees an anti-seizure medicine and an estrogen-containing birth control pill, it basically revs up. It starts to increase its capacity to process those substances that are going through your blood. And in revving up its processing capability, it clears the medicines out faster. It clears out the estrogen faster and gets rid of it. It clears out the anti-seizure medicine faster and gets rid of it. So in effect, when you're on an anti-seizure medication and a birth control pill, you may need to be on a little more of both of them to get the same effect. And you can't count on the birth control pill to prevent conception if you're on an anti-seizure medicine. Not in the same way. So we always recommend that you have a barrier method in addition to the birth control pill if you're on an anti-seizure medication.
How many kids or young adults have epilepsy and something else along with it?
Most people who have epilepsy have something else along with it. There's various terms we use to talk about what that something else is, and I'd say it usually refers to some either difficulty with mood or your sort of psychiatric or psychological life, or in the area of learning and memory in school. We're not entirely sure how much it's due to the medications used to treat epilepsy at times, or to the epilepsy itself and the effects of having seizures. But it is known that even though you may have seizures well controlled on medication, that these problems are often present. So most people who have epilepsy also have something else, and the something else about 80% of the time. And the something else is either some mood disorder, anxiety, depression, worries, or it's to do with the medication slowing them down, or the epilepsy itself slowing them down.
I heard you can have brain surgery. When can that happen?
So yeah, brain surgery is something that is an option for a number of people. We try to identify who might benefit from surgery as early as possible in the course of having epilepsy. And determining a person's surgical candidacy is an important task of what the neurologist should be doing. In general, if you don't respond to the first or the second medication, then you would be moving into the area where we'd be thinking, maybe there's another approach here. If you come in and have epilepsy and there's an obvious reason for it, a brain tumor or some other cause, an old scar from an injury that happened long ago, for instance, then you may move towards a surgical approach even earlier in the game. But if you're generally coming in and we don't really know why you have epilepsy, which is the majority of people, and there's not an obvious cause on your scan or somewhere that we could say, okay, that's going to require surgery, then it would be a matter of trying a med or two, seeing if you respond to them, and if you don't respond, then addressing the question of whether there's a surgical option. Unfortunately, the surgical option is not there even for a lot of people who fail the first couple of medicines. And establishing surgical candidacy is a process that we go through a lot of testing, a lot of evaluations, in depth, looking at your brain and trying to figure out if we would help you as opposed to help you and potentially harm you by addressing it with surgery. So it's a long process. Takes a couple of years for most people before you get to the operating room. And along the way, obviously, there's always the possibility that it will be in a place that can't have surgery done on it in terms of where the seizures are coming from. Or maybe a combination of other medicines will help, and we'll say, okay, really not the right time to do it. In terms of the timing of epilepsy surgery, the bias in the whole field has moved towards the earlier the better. So if you are a surgical candidate, getting that established early in your life and moving towards surgery is a good idea rather than waiting the 20 or 25 years that in general is what happens today. There's a couple of things you can do. One is, if you remember you didn't take it right then and there. A dose missed can be made up all the way until the next dose is due. If you remember at the next dose, oh, I didn't take it because there are the pills, then you can take half of that dose at the dose that you're taking, your regular dose, and the other half at the next dose. So you can make it up over 2 doses. But I think the vast majority of people remember it sometime a few hours after they forgot it. They've gone to school and they're sort of, oh, yikes, I forgot my medicine. And you can just go to the school nurse, have a little supply of medicine at school, and take it then. It's no big difference, and I think that you can make it up easily that way. What you don't want to do is say, oh, I forgot it, and then, well, I just can't make it up, because for some people at least, if they skip a dose, their level will slowly go down, and even though they take their next doses, it may not come back up for about 2 days. And during that time, you may be vulnerable to having a seizure.
Why is it that some days I can do so well at learning, but in other days I just can't learn very well at all?
I think the variability in learning is probably the biggest challenge that we have and the biggest mystery of epilepsy, but it's very common that probably due to underlying activity of the brain, either while you're asleep or even while you're awake, but that's clinically silent and you can't tell you're having any of that abnormal activity. Probably due to that, your ability to remember, to learn, to pay attention, and to consolidate those memories will be affected. Most people who have epilepsy, even when they're not having a seizure, their brain will have abnormal activity periods, and that can wax and wane. And it may be reflecting that variability in brain function and the resulting variability in your ability to pay attention and learn and remember.
Even though I'm having seizures, can I still drink and smoke?
When we talk about mixing a seizure disorder with alcohol or smoking, be it marijuana or cigarettes, what we try to keep in mind is that you have something called a seizure threshold, and that is the set point at which your brain will go into a seizure. It's maintained high by nature in terms of the getting good sleep, good nutrition, keeping fit, and taking your medication, which all serve to raise your seizure threshold. And it's lowered by any substance that acts on the brain. So many common drugs that are taken for other conditions can lower your seizure threshold. Alcohol, of all of the things that you might think of, lowers it quite dramatically and quite effectively. So if you drink alcohol, you're putting yourself in harm's way and putting yourself at pretty much high risk for having a seizure, even if you're on your meds, because it's a powerful seizure threshold lowering agent. Other drugs also, if they affect the central nervous system, can serve to lower your seizure threshold and again tip the scales to favor having a seizure. A lot of times people stay up late when they do those sorts of activities, and that sleep deprivation is another additive effect as well. I think the smoking of cigarettes is probably to be avoided for other health reasons and for many other reasons. It's a good idea not to get into the habit of smoking cigarettes, but they probably don't have much bearing on seizure threshold particularly or on seizures. They just have other major health problems associated with their use and the addiction to nicotine, which is hard to kick. The other drugs that you might use again, it would be a matter of what effect do they have on the seizure threshold to determine what effect they might have on your using them and having epilepsy. And in general, avoid them if you can, because it's not likely that they're going to have a beneficial effect on your seizure threshold. Marijuana is often laced with other substances, and those other substances are often stimulants or medications that do suppress the brain activity and cause the seizure threshold to plummet. So you may think that you're smoking marijuana or having marijuana, and it may be that it's super strong because it's been laced with something else. By itself, when they've looked at marijuana, it tends to cause low blood pressure more than it causes lowering of the seizure threshold. But for some people, the lowering of blood pressure can predispose to seizures. And for some people, the sedation effects of marijuana, the making them sleepy and drowsy, getting them into that state, may predispose them to seizures, because the sleep state and the drowsy state is, again, associated with a lower seizure threshold than the awake state. So for those reasons and many others, it's probably a good idea not to mix the two if you can help it.
Will I always have to take my medicine, or will I ever grow out of having seizures?
The vast majority of people do. However, depending on your specific profile, and it gets very individual, you may not. There are some genetic epilepsies that are easy to treat, well controlled on a single low dose of medication, but they never are outgrown. And then there are epilepsies that seem like the end of the world, and there are multiple seizure types, and they're happening all the time. And magically, you get a certain age and they're outgrown. Most of the epilepsies that are outgrown are genetically based as opposed to acquired through some injury or something that's happened to you. And that of course is the majority of epilepsies. And the ones that are genetically based often in childhood have their time when your brain will be at a developmental stage and will have a lot of seizures, and then by puberty or adolescence usually will outgrow it. You'd have to ask your doctor what kind of epilepsy you have, and in determining what kind of epilepsy, you can find a little bit more out about what the prognosis, what the future looks like for that epilepsy. I think transitioning to adult care is somewhat individual, but it should be thought of as early as 12, 13 years old. And for the individual, probably really planned on by around age 18 to 19. Sometimes we'll see people through college just because they're still at home, and it's kind of a nice setup too, and convenient. But at some point when you're around 16 or 17, I think it's a good idea to start really taking control of your condition, learning about it, pressing your doctors to educate you about it, and beginning to really know what medicines you're on, what the doses are, and take control of it. Because I think at a certain point, if you can manage your epilepsy, then you'll have a much better time of it, you'll have a much better control. You'll be the one informing the adult doctor because your parents won't be going with you to those appointments. So practicing that when you're still kind of going with your parents is a good idea. And I think that process begins whenever you want it to as an individual, but certainly should be well on its way by 17 or 18 years old.